All right. Welcome, welcome. Hi, everybody. My name is David Bolden. I'm the audit manager with Advise Health.
And hello, welcome. I am Mandi Berg. I'm one of the senior managers on the New York SIU team. Thank you for joining us.
Yes, thank you. Thank you. Today, we're going to be talking about some insights and trends that we saw in 2024, and then also how you as an organization and individuals working in healthcare can look for things in 2025 as well. A lot of really interesting things are happening right now. A lot of things are going on within the healthcare and compliance space. So we want to make sure that everybody is aware of kind of those trends, those changes that are happening, and be comfortable speaking with your organizations or providers with regards to these things. So we'll start off, I guess, with compliance. And really, compliance has been the name of the game, right? Like for a while, right? Like we have seen time and time again in every audit or every review we look at, as far as compliance not being something that is kind of understood fully within an organization or even with providers, right? And for providers to not have the proper compliance measurements in place, the compliance officer, compliance plan, things like that, that are kind of the basic things you should have for making sure that you're following a compliance, a regulatory program, right? And that's important. And we're seeing that that's not something that's happening. And we're seeing the scrutiny of the government right now, the government coming down and having more and more audits. They're looking particularly at certain codes now, especially in the home and community-based service area where, there wasn't a lot of kind of notice before, but now they're seeing a lot of kind of like that bleeding and that waste kind of in that space. And they're looking really hard at those codes and those services that, we weren't necessarily looking at before. Before it was really, modifier 25, modifier 59,
Exactly.
but now we're looking at, these other codes and people are like, oh my gosh, like, what am I doing? What should I do? And, we have to make sure that you're staying up to date with those compliance policies.
Absolutely. And especially just as you had mentioned, right, with the audits. So there's going to be a big change transitioning in 2025 with, in particular, home health, CD-POS cases, right? The
Mhm.
electronic verifications that are going to have to start occurring. A lot of questions are coming from plans, like what do we need to start putting into place now to make sure that we're matching the compliance numbers that are going to be required. So just like
Yeah.
you had indicated, it's a matter of one, kind of planning ahead, knowing what is coming down the pipeline, and starting to put kind of an action plan into place so that when these deadlines start coming, you're ready to kind of roll. So I know one of the things that like you and I have talked about a lot of times is especially for auditors, investigators, even our plans, there's a big question of hierarchy, and that's the rules and regulations and what
Yeah.
essentially is primary, what is secondary, tertiary, and so on. So it's kind of wanting to gauge some input from you from an
Yeah.
audit perspective, the way that you guys go about those.
Yeah, yeah, definitely. And I think that that's a very important piece, right? Because we have all these guidelines that we should be following. So which one takes precedence? I know we're working on a project right now where that is a huge question. What takes precedence when we're looking at a state policy versus a plan policy or a CMS, right? And CMS has two M's, right? Medicare, Medicaid. It's not just one. So we're looking at all kinds of regulatory policies. So from an audit standpoint, we always like to look at the plan first. That's where we're looking at that guidance and that kind of like what do they want to see as far as documentation standards? What do they want to see as far as provider credentialing and licensure? But if it doesn't lie there, we go to state Medicaid policies, and those state Medicaid policies are usually pretty comprehensive with regards to what they expect to see from certain services, from certain documentation, and what the compliance level of those are. Or, you know, after that, you've got federal, right? So CMS, plenty of information in CMS as far as like what the regulatory requirements are, especially for DME, especially for, like chronic care management, like things like that, like things that we're going to be seeing in 2025 and that we have seen in 2024 that have been pretty big problems. But as far as from an investigator side, like how does that work with regards to what do you look for as well?
Yeah, so it's a great question, right? And one of the first things that just I like how you mentioned it too. It's like know your plan, know your policies,
Yeah.
because that is it's key and crucial as well. Certain plans, depending on what kinds of lines of business that you monitor and you work with, they're going to have different rules. They're going to have different regulations. While there are like those national standards, there are always, unfortunately, sometimes an exception to the rule, and you need to be
Yes.
aware of it.
Yeah.
One of those things that come into play are such a thing as like a provider contract. What does their actual contract state?
Yeah.
If their contract states an allowance to do something in a manner that we would not typically see, that does impact how an audit is run.
Yeah.
And it can also impact whether or not you can pursue an audit or you have to close one.
Yeah, exactly. And it also, to your point, it affects any sort of reimbursement, any sort of recoupment, right? Because they might have a whole different fee schedule within their contract versus what would be a normal fee for service or Medicaid, like kind of reimbursement rate. So that it all takes effect. And I think that having that level of understanding of what do you use first and what do you use if you don't find anything, the answer isn't because it's not there we can just do what we want, right? That's never the answer.
Uh, but that's the favorite answer that we get from a lot of these providers. Well, nobody told us that we couldn't do it like this.
Yes, yes.
But there are so many references that have stated that you cannot. So it is crucial in knowing your plan, your policy, and just like you mentioned, the hierarchy of the rules and regulations.
Yes, definitely, definitely, definitely. So how would you say from an investigator standpoint, how can someone like be prepared to like really go into 2025 kind of understanding what is the requirement for like setting up some sort of like compliance within their organization or even setting up investigations, right? And to make sure that they're doing things the right way. Like how would you see that?
Absolutely. From a compliance standpoint, I mean, it's very similar to like you as auditors or even what we expect providers and plans, right?
Yeah,
It's all about documentation. If it's not documented, it didn't happen.
yeah,
Additionally, the data is the building blocks of your case. So you need to make sure that the data that is coming in is clean and that when you are processing the data, that it is also clean and accurate to the best of its abilities possible. Um, and that comes to playing a role as well with collaborating with the auditors, right?
yeah,
So our investigators, they're not coders, and that's not their job. And I hate using the line for anybody, like, right, that doesn't fall into your job because it's an ever evolving process, right? Your role in this is actually something that all everybody should understand is like, what is your role? Your role
hmm
is to basically take a case and work it to the furthest extent that you possibly can.
yeah,
And that doesn't mean that if you don't know an answer, you don't go looking for it. The
yeah,
nice thing about the company that we work for is that we have a lot of variety and diversity and subject matter experts. So
yes,
we use
definitely.
that to our benefit and we lean on those. So, like, if I have a coding question, I'm going to reach out to the auditor team and I'm going to be like, well, I know that they can't do this for XYZ reason. What else can you help to support my audit findings? And
hmm
kind of go from there.
And I think we've had kind of like these webinars in the past, and we've talked about the collaboration between investigators and auditors. And that's to your point, what you're saying is that it's crucial for that communication to happen because that's how you can get these investigations further and further along and make sure that you're getting what you can get out of it, right? Like you don't want to just say, I don't know how to go past this, and so I can't, look any further in this investigation because there obviously isn't anything there. There's always, well, I'm gonna say always, most of the time there's something there, right? And so it really takes that kind of collaboration in order to make sure that you're doing it. Um,
As a plan, one of the things that would be very beneficial for plans to keep in mind too, right? Don't have silos between your departments. Your compliance department, your provider relations department, your contracting department, the more comprehensively that they work together, the stronger your plan is going to be and the more protected you're
yeah,
going to be. A
yeah,
lot of what we see and what I have experienced in the past is that when contracts are written, a lot of times they'll actually put like a specific procedure code in the contract. And the problem is those codes, as anybody is aware, they change and get reviewed multiple times a year, or the code description gets updated. So when you have put yourself into a box on a contract and specifically spelled out a procedure code, if something has changed from the last time that you did that contract and now,
hmm
you're held to what you have in writing.
hmm
So having those open lines of communications within a plan, right? Your contracting department, your authorization department, they should all be speaking together and
yes,
having a general understanding of your policies and process. And
yeah.
if there is an area of risk or exposure, working as a committee to really kind of navigate through that and find a way through those roadblocks.
Agreed. Agreed. I've been in situations and organizations previously where they've had codes put into contracts and we've seen the repercussions of what happens with that is the provider come back and say, well, I can do this because it's in the contract. And as an auditor, as an investigator, we're kind of bound by the fact that you put this into your contract. You agreed that this is something that they can do. I'm not really sure how to move forward, other than there's an educational piece, right? Obviously, if there's some documentation things, just because they have the codes in their contract doesn't mean they're still not held to that documentation standard.
Correct. Yeah.
But as far as the correct coding piece, that's the auditor's and a coder's nightmare is that they're using the wrong code. That's our nightmare, right? And there's nothing we can do
Absolutely.
about it.
Well, and it comes down to ultimately the claim. Your claim's no longer clean because it's not an appropriate code.
Yeah,
So it
yeah,
comes into a lot of compliance questions.
yes.
So I can say what we saw was hot in 2024 and what I fully anticipate to still be hot in 2025, DME, which you had mentioned earlier.
Mhm.
So the documentation standards are one of the areas where we are seeing a lot of areas where improvement is needed and where there's a lot of risk and exposure. These DME providers are aware of what they have to maintain and what they have to document, but they are finding areas of vulnerability and they are running with it.
Yes, they are.
Um,
Yes, they are.
Senior
And
adult, oh, sorry, go ahead.
oh, I'm sorry. No, I was
Yeah,
going to just add to the for DME.
yeah,
Medicare has extensive guidelines for DME, and I know that there's a really good resource out there in MLN where you can actually go and you can click on whatever service you want to look at, and it gives you the guidelines for that particular uh, procedure or those services that are in that DME space. So it's definitely something to look out for. Just like the man said, it's huge. It's huge.
I also liked how you mentioned earlier the chronic care management codes.
Hmm
Those were big in 2024, and they are on the OMIG audits for 2025. The chronic care management, transitional care management, all of those codes because of the fraud, waste, and abuse that has been seen with each of them. So I like
Yes.
how you mentioned the MLNs because those are
Yes.
out there for those codes as well, and they are very comprehensive on the do's, the don'ts, what needs
Yes.
to be in there.
Yes. What's the saying? Know your resources, know your
Mm-hmm.
policies, right? This is stuff that's out there and readily available for everybody. This isn't just stuff that we can use because we're auditors and investigators. Anybody can look at this stuff. So really, really get to know that.
Absolutely. And then senior adult daycare services.
Yeah.
Those are going to be a hot topic for 2025. They're actually on the OMIG work plan for next year. So we've had some interesting developments that have come through with some senior adult daycare centers in general. One of the things that, from an investigative standpoint, that we are finding is not only are they billing for the senior adult daycare services, but many times they're also billing for transportation back and forth. And
Yes.
the audits that we've seen thus far, transportation is almost never
Yes.
supported, and they
Yes.
do have to maintain that documentation. And then there's been a lot of deficiencies in the senior adult daycare center documentation. I kind of wanted to lean on you as an auditor to run
Mhm.
through what you've seen as far as those deficiencies and kind of how we can plan for those for next year.
Yeah. I think in the documentation space, that the biggest thing is that it just doesn't support whatever they're saying that they're billing. And so for senior adult daycare services, the biggest thing that we see in the audit side is that they're just there. Right? Like, I don't even know what else to say other than that. They're just there. I
They
mean,
walked through the
yeah,
door.
they
That was
walk through the
it.
door and they stay there for 8 hours, 6 to 8 hours, and then they leave. We all know that this is a service. Anything that you're billing to Medicare and Medicaid, these are services that should be medically necessary in a treatment plan. And there's specific things that they should be doing or trying to do, right? The attempt to do something is still doing. And that should be in line with whatever treatment plan, whatever treatment goals they have. So the fact that they're coming in and we're seeing this in documentation and they come in, they eat, they talk, they leave, right? And you build transportation, that's not sufficient enough for the requirements of these medically necessary services.
Yeah,
Yeah,
absolutely.
yeah.
I find that the transportation piece is actually quite mind boggling as well for the whole fact that it costs almost as much exposure as
It does.
these adult daycare service
It does, yeah.
codes
And
do.
a lot of transportation and not just for adult daycare services, but for other services as well. A lot of the transportation service codes require the start and end mileage, require the addresses, right? And these are all things that are missing from the documentation, but you're billing 100+ miles saying that, they lived all on the other side of the state. I mean, right? It doesn't make any sense. So it really comes down to documentation. It really comes down to compliance, understanding what needs to be included in the medical record to support these services.
Absolutely.
Yeah.
Um, and I know one of the big things that we have talked about before is it's as simple as remembering that change can start with you, right?
Yes.
So
Yes. Yes.
while you might not have all of these things in place now, right? It's just a matter of a starting point.
Yeah.
And once you start that, you can literally check off each thing as you go.
Yeah.
So, what are some key highlights? I know time is coming close, so just
Yeah.
kind of
I
to
know that
wrap
one
up,
guy.
and so we can also allow time for questions.
Yeah.
What are some final, like, parting recommendations that you would have for 2025 to be mindful of besides like DME, the senior adult daycare, chronic care? What do you see coming down the pipeline?
I would definitely tell providers to look out for E&M, right? That's going to be the thing. Every year they make some change to E&M guidelines. So definitely look at the E&M. They're going to be trying to streamline, as they've been in the past, they're trying to streamline documentation, how the providers can report certain things in addition to, we've got the new G code, the 2211 code, right? Which you can build as well, which that's a whole, new can of worms in itself. Um, so there's all kinds of stuff in that realm. Also, look out for global surgery and global modifiers. So they've expanded on those definitions for global surgeries. Pre, post, and kind of like the operative kind of like um, oh my gosh, my mind went blank. The operative code set that you can build for. So
Sure.
look out for those because that is going to be a requirement for reporting when they're doing transfers of care during a operative period. So definitely look out for those types of like modifiers and look out for I know psychotherapy and actually behavioral health is another thing that's going to be a huge thing in 2025 as well. So that's definitely kind of my specialty. But look out for that kind of stuff because again, these are these are individuals and members who are in a kind of like vulnerable population. And so CMS and plans are really going to be looking at providers to really justify why they're billing for these services and how the members are getting better. How are they progressing in their treatment? Like, what are we doing in order to make sure that these members aren't staying in the same cycle over and over and over again? So that's really what they're going to be looking for in 2025.
Yeah, no, that's excellent information. And you're
Yeah,
right. That is something really important to keep in mind is that your members shouldn't be treating forever, right?
yeah, yeah.
It's in the data, you see that members are receiving this care for just absurdly a long amount of time.
Yeah.
Those are red flags to be looking at as well.
Yes, yes, definitely, definitely. Cool. Awesome. Well, thank you very much. I know we're coming on time, but I appreciate always talking to you. I know it's the holidays
Same
and
here.
we're all busy and getting ready for the hot cocoa and the Santa. So, really appreciate you and everything you do. I love working with you. Just you guys know me and Mandy work together, so love
We
it.
do. It's a great collaboration. So, as always, nice having a conversation with you about this too and bringing
Yes,
it
definitely.
essentially to all of our advised family out there. So, thank you all for
Definitely.
joining us.
Thank you so much.